Record to my class. Get one more to come in here. Good afternoon, everybody. Welcome to our Lee County Bar Association Elder Law Section virtual meeting here. We have two guests for the day who will be giving us some information that we all need to know. Maybe not right this minute, but we will need to know it shortly. This is Kathy and Dave Siganek, and they are going to be presenting today. I'm going to hand it over to you guys.
Thank you, Lauren. Lauren, we have the meeting recorded on our screen, so do we need to get that off for a second, or?
Nope, you are good to go.
Okay. Well, it's right in front of our presentation, so do we need to hit got it?
It's not showing on our end, so you guys should be good to go. Just continue with moving on with it.
All right, we got it done.
I got it.
All right, so welcome everyone. My name is Dave Siganek, and I'm a licensed insurance agent to do Medicare plans, and we're going to be offering you some education on how Medicare works and some of the options available to the marketplace. And the information we'll be talking about will be for this year, 2021. And as you may know, deductibles and co-payments do change year over year, but we're always here as a resource. If you want updates on that, we can offer it to you. Kathy?
Hi, some of you know me from guardianship. I am a professional guardian, but what you may not know is that I've been in the insurance industry for well over 20 years. And every year around this time, Medicare comes up, and I work with Dave doing some of the educational and Medicare events that you may see. So this is some contact information that you can reach us at. It will be in the presentation. So we're here to get to know about Medicare. And these are some of the topics that we're going to be covering. You know, basically, what is Medicare, who can get it, yada, yada. Okay, so what is Medicare?
So the important things here is that Medicare is a federal program and it's individual. A lot of people think that there's family coverage available. No, it's individual. And for the most part, everyone pays their Part B premium. There are some exceptions when you get into Medicaid, but we'll go through that. Okay, so it's not a family plan. A lot of times the Part B is paid through the Social Security if you're taking Social Security benefits. Optionally, you could get a bill in the mail if you're not taking Part B, but we'll go through that as well.
Okay.
So Medicaid is another program that's available. Sometimes it's when it's joined with Medicare, we call that a dual plan. And you can see at the bottom there, dual eligibility. And there are really situations where that is very, very appropriate for clients. There are some income and asset tests that Medicare go through, but when combined with Medicare, it's really a resourceful plan for people that a lot of the copays and co-insurance are virtually brought to a very, very low level. So.
Okay, so the next question is, who can get Medicare? And basically, if you're a US citizen or legal resident, you can get Medicare, but you have to be 65 years or older, or if you're under 65 and you've been on disability for 2 years, then you have a qualifying disability, you can have Medicare. And then, of course, anybody with end-stage renal disease is eligible for Medicare.
So when you have Medicare and Medicaid, you've got the dual eligibility, and we're actually going to talk a little bit about how those plans work. One thing to keep in mind for this presentation, we're not going to go into specific plans, just generally the structure of how these are work, and more so who is eligible for them.
Okay, so do I need Medicare if I plan to work past 65? So that's really dependent on whether you have group coverage is considered credible and the number of people in the coverage, or if your spouse is covered under the employer's coverage.
We get this question a lot. 65, 66, 67, do I enroll in Medicare? how does it work? Remember, Medicare, we'll go into it as two parts. And one part, Part A, really doesn't interfere for the most part with either of the decisions at 65. However, if you do have spouse employment or dependent spouse employer coverage, you may want to delay Part B, but you have to be careful when you come off the group coverage that you apply for Part B.
Okay,
The middle part is really important. So we have some people say, I've got an HSA account, I'm still working, fully employed, and they meet some of that criteria that we had about the 20 employees. They'd like to continue an HSA. If you take Part A or Part B or any part, then you can no longer contribute. So we do have some clients that are 67, 68 contributing to an HSA account. They haven't really applied for Medicare because they have creditable group coverage. And we don't know that until we actually sit down with an individual situation. And that's probably as a resource that we can help you. If someone is in that situation, we can help guide you through that.
okay, so Medicare, we all know it's parts A and B, and generally Medicare, Part A is your hospital coverage, Part B is your doctors and any outpatient care. And, Medicare covers the hospital stays and inpatient care. And what a lot of people don't realize is that it picks up a lot of the hospital stays. It's not just for your room. It does take care of all the prescriptions that you may get in the hospital, your lab tests.
In fact, rehabilitation services, the last one after a qualified inpatient stay, would still be a Part A coverage. So largely, though, it's the hospital care and everything associated with the hospital. Next. Some of the ways that people get Part A, if you've paid creditable for 10 years or longer on Social Security credits, you can't be denied. Remember, Medicare has no qualifying medical questions. So, you just apply if you're eligible. The other part is with the coverage period generally is a 60-day benefit period. So if you go and you're an inpatient in the hospital for a broken leg and you're in there for 2 days, Medicare counts a 60-day period from that day of admission. If you ever were readmitted for that condition again, you no longer pay the deductible. And we're going to go into what that deductible is on Part A later on in the slide.
Okay, Part B is your medical, your doctor visits, any outpatient care, your x-rays, any clinical labs that you have, durable medical equipment.
So just go back to that one slide. So the second bullet point on the left, the annual wellness visit. When you have a Medicare visit, you go in and you have a discussion about your conditions, but if it goes into, gee, doctor, I have a sore throat, prescribed medication, that's not called an annual wellness visit. So sometimes we get questions about that. Do I just want to go into the doctor and just get blood tests and things. Well, the annual wellness visit is more of a, let's sit down and just have a discussion on how Medicare would work for you, okay? And of course, preventive services, flu shots, different things like that are covered in this particular part of Part B.
Okay, some fast facts here. Your Part B premium is, you have to pay your Part B premium. That's what gives you the coverage. If you have a certain level of income, it may be adjusted, and we'll go into a little bit more about that. Again, you can't be denied coverage. Coverage is nationwide. And if you don't, and this is probably the most important part, if you do not enroll in Part B when you are first eligible, you may have a late enrollment penalty for it, and you may not be able to do it until a certain time of the year.
Two things to keep in mind: a monthly premium, you hear maybe on TV or ever, $148.50 is the Part B price this year. What does that mean adjusted for income? Well, based on your last 2 years filing of your tax return, there are breakpoints where, if depending on your filing status, the income over certain amounts could add to the monthly premium. So you pay $148.50 plus a surcharge. Then at the bottom, we talk about special enrollment period that sometimes they abbreviate SEP. And we'll go into some of those situations where you never qualified, but you have a special enrollment period.
Okay, there are things that Medicare doesn't cover. It does not cover your prescription drugs. So that is a separate section of Medicare that you could have, and there's different ways that you can get drug coverage, but it is separate. It doesn't cover any of the dental, vision, or hearing. You see on TV, again, a lot of those things get some of those extra benefits that Medicare doesn't cover. And there are ways to get that, but we'll go through that.
The prescription drug section would be basically go to the pharmacy, get a 30 whatever supply, and you walk out of the store with your prescription drugs. There are some of our clients actually that get medications in the hospital, infusions. That would be a situation where Part B would cover those, but it's on a case-by-case basis. So sometimes drugs are covered, but the prescription drugs here we're talking about is the limited monthly 2-month. The second thing is, which you would probably want to be concerned about in counseling your clients, is the excess charges for services. When a doctor says, oh, I take Medicare, the second part of it, the question to ask is, do you accept the assignment? That's quite two different questions right there. So if they accept Medicare, but they don't accept what Medicare's billing is, then there's a formula of roughly between 14 and 50% that can have excess charges billed back to the client. So Medicare, I guess we could say it's an older legislation, still has excess charges. We don't see it much in group insurance at all, or in what we call managed plans, but that's something to consider if you just have Medicare A and B.
Okay, so where can you get more coverage? Let's talk about the different options here. You have your Medicare A and B, the red, white, and blue card. There's different avenues. You'll see option 1, that is the standard, what was before option 2 came into play. It's you can have a supplement plan or your prescription drug plan. Option 2 is what you see on the televised ads right now, are your Advantage plans. It combines your Medicare Part A and B. You don't lose those. You're not replacing the coverage. And in some cases, it does add Part D, and it may offer you some of the additional benefits like the vision and the dental.
One thing to keep in mind on the supplement, it's an umbrella, and there are various versions of how much do you want to cover that phrase there, some or all. And of course, these are premiums that you would pay out of pocket. The other part is all the letters on this page, D, C, and D down there in the Advantage Part C plan. These are all offered through private insurance companies. Medicare A and B is the federal part. Anytime you see C or D, these are plans that are offered by private insurance companies. So that's a nice distinguishing factor that you can, kind of bring to fore when you're talking to your clients. So here's the C, okay? So how do you get Part C? Well, it's not offered through Medicare, it's offered through a private insurance company that packages A and B together, okay? And then a lot of times what they do is they put in a drug plan. Some clients actually don't want drug coverage, or they get it elsewhere. And so we do have the options to just do Part C on the medical part, okay? And then here's where you see a lot of the extra benefits, dental and vision, in the C plans.
Okay, I think we kind of just went
So we
through
kind of,
these. We just did the Medicare Advantage, what you can. So in addition to some of the things you see are the hearing tests. These are all the additional benefits, the hearing tests, the wellness programs, and the fitness memberships. Okay, there are several types of Advantage plans. You have the HMOs, the preferred providers, and point of service. And then when Dave was talking before about the duals with the Medicare, Medicaid, they have a special subset plans called special needs plans. So depending on whether you have a chronic condition or you're in an institution or you just fully qualify for Medicare, Medicaid?
So the one thing we get a lot of questions on when people say, gee, I like this plan, oftentimes there's no premium on the Part Cs. Do I have to pay my Part B? Yes, everyone has to pay the Part B. Oftentimes we give an analogy. We're building a house here and Medicare's Part A and B is the foundation of your house. And if we wanted to add some walls or second stories to it, Part C is built on top of that. Okay, so that's very important. A lot of people are actually unaware of that. They just think that this is just free and they're going to get all of their premiums back for Part B. There are options to do that, but not unless you qualify for a state Medicaid program.
Okay, your Part D prescription drug coverage, we always get a lot of questions on this. What does it cover? Do you have to have it separate, or it can be bundled into an Advantage plan? There are formularies in the drug plans, and they are reviewed every year. And it does not cover some of the vaccines that would be covered under your Part B. In the drug coverage, the formularies are tiered. So your lower tier ones are basically your preferred generic on up to tier 5, which is your specialty drugs.
We often get questions on what in the world is this donut hole? Okay, the thing to keep in mind about drug plans is that drug plans may have a deductible, or they have a deductible that's waived. So the first thing to look is, what is this particular insurance company's drug plan? What's the deductible? Okay, so if the deductible is $450, then that would be paid before any initial coverage stage. But a lot of plans in the Part C sometimes waive these deductibles. They start right on to initial coverage. That's where you see it's $3, it's $10, and all of that. Once your total drug cost of $41.30, then you have a period of time, $65.50. Actually, we can update that $65.50 now for 2022. It's $7,500. And the 4130 is $44.30, but for purposes of this slide, we didn't put those in there. So there's a period of time in that donut hole where you're not on the $3 payment plan anymore. You're generally on a percentage of what the drug costs. But once you reach $65.50, you can see the gap is there, probably a couple $1,000s. Then you get into the other side of the donut without the hole, and you start biting onto what they call catastrophic coverage. Generally, these will come out to be any one of a $3, $8, or possibly 5% of the drug costs. This is just some more information about that. Spend a little time on the supplement, Medigap. The way this works is if you were to go to the doctor and you had a supplement insurance plan, you would give the doctor's office your Medicare card and your supplement card. Oftentimes, the offices say, do you have secondary insurance? This is what they mean by secondary insurance or supplement insurance.
Now, on the, just if I may interrupt, on the supplement plans, you have the plans vary by, I call it the alphabet soup. You have 10 different plans, and they are standardized across the United States. So it doesn't matter which one, where you get it. It's the same here as it would be out in California.
Just the premiums may differ amongst companies.
Okay. As Dave said before, the supplement is an umbrella. It does pick up, depending on which plan you have, the Part B coinsurance and the Part A deductible. Some of the plans do include travel. What they
It's a reimbursement plan. Generally, it's 80% of a reimbursement amount. You would pay it and then get reimbursed. The other part about the supplements is they don't have any prescription drugs, routine dental. Sometimes there's discounts, but associated, but that varies amongst companies.
this is the alphabet soup that I was talking about, Plan A on through Plan F. And generally Plan F, there was a misnomer out in the market, not when they first decided they were going to do away with Plan F. They haven't really. As long as you turn 65 before January 1 of 2020, you are still eligible for that Plan F.
So the main thing of this chart is Plan F is still there. And if someone is working and they decide to retire at 70, but their Medicare, they have a Medicare Part A usually, predating 1/1/20, they're eligible for Plan F. So there could be some people in the future that could do Plan F. Why? It's a personal decision. Plan G, if you look at the column there, is virtually identical to F in terms of what's covered, particularly the excess charges. The only difference with G is you pay first the Part B deductible. Currently this year, it's $203. Okay.
And you'll also notice under the plans, the way they've designed them is that Plan A is your basic plan. So every plan after that has everything that Plan A has. So it will follow across.
So I think we kind of got through this. However, since the fast facts, it's nationwide, there's no network. It's the Medicare doctor network. So a lot of people like that idea, particularly people that travel, have multiple residences in different states, or they're seeing special doctors, or they're going to, maybe a hospital that's a research hospital, and they just want to take Medicare. The other part is it's guaranteed renewable. That means as long as you pay the premium, you cannot be canceled. So a lot of people like that idea. Okay.
Okay, Medicare costs.
Just terms here, and I think we've covered those. So what we've done here is kind of a little bit of a grid on the Part C plans offered by insurance companies, the Part D prescription drug plans, and the supplement plans. Okay, so one thing that's across the board is that the monthly premium on these plans, usually the Advantage Part C's in this location anyway, in this county, there's either a low or a zero monthly premium. If you took a Part D standalone, there is a premium more than likely. And then the supplement plan definitely has a premium based on whatever letter alphabet, as Kathy said, you decide to choose. The other thing about the supplement is, whereas the premium for the supplement is a fixed amount, the coverage that you can get is not, it's open door. Okay, so you could have as much of claims as you want. The bottom part there, the Medicare Advantage, have an annual out-of-pocket maximum. We'll talk about that a little more, but I just wanted to bring this up about the Medicaps.
So this is really an important kind of a chart, your Medicare coverage combinations. There's really no one fit for each person. It's very individualized. You may just want to stay with A and B, but if you stay with A and B, you're subject to unlimited costs. They could go up, you just don't know. On the A and B, so that's your ground floor, you can add your Part D if that's just what you want, or you could do the umbrella, or you can do the bottom one, which is both AP plus your prescription plus your supplement or your umbrella program.
So if you were to say complete coverage with original Medicare and an umbrella Medigap policy, that would be the last configuration in the left column. You have your Medicare, you have your Part D prescription drug plan, and you have your Medigap. In this time, we're in what's called annual enrollment period. It's the drug plan that a lot of people are looking at because they're subject to contractual negotiations each year. Remember, it's a private insurance policy. The Medigap is just going to pay whatever A and B, so that doesn't change. Same thing goes on the right side. The Advantage plans, these are yearly contractual agreements between Medicare and the insurance companies. Normally, what we see in the marketplace for Part C is the last. It's Part C and D, but it's combined. They never show the D. It's just kind of a combined plan. You see a lot of this on the advertisements on TV.
So this is just another visual on your choice options.
We show this to clients that are saying, how does this all work? This is very clear in terms of start with your base floor, your foundation. There's your Medicare card. Now you have two options, and we go into explaining two options to them. However, we base that on the value the client sees on their health care. What are they doing? Are they seeing a doctor multiple times a month? Do they have a condition that warrants one plan over the other? It's really not one thing. It's everyone's situation is different. So to just say, I like this because it's $5 or $10 to go to the doctor, when you have a condition that may cost you more within the plan, that needs to be brought out. And we have that discussion with everyone that we counsel on one of these two options. Kind of a chart you can go through in terms of the coverage, the cost. There's a lot of insight that can go into this. Some people may have providers that they like the nationwide coverage that Medigap gives. Whereas I talked with the client today, I'd like to take a look at a Medicare Advantage plan. They had 8 doctors. However, 6 of them were only covered in the network, whereas all of them were covered on the nationwide. And, so it's something that we like to bring out to make sure that clients understand that.
Okay, so the next thing is, when do we enroll? These, I always get questions on this. Medicare, your initial enrollment period, you really have 7 months, 3 months before you turn 65, the month of your 65th birthday, and then 3 months after that. And you need to make sure, if you are first time enrolling in Medicare and you are not receiving Social Security, that you need to actually either go online to ssa.gov or go to Social Security office and complete an application to enroll, because otherwise it is not automatic. It's only automatic if you are currently receiving Social Security.
One thing to go back to that chart, one thing to keep in mind here is Medicare always dates coverage the first of the month. Okay. So if you wanted to have at age 65, all your Medicare that month, you need to make a decision in months 1, 2, and 3. You need to do it before the 4th. So whereas, yes, you can take the 5th and the 6th, but if you decided to enroll in Medicare on the 5th, your Medicare coverage would begin on the 1st of the month in the 6th month. So even though this is a 7-month period, we often view it as a 3-month before period. And we make that very, very clear to clients. And most of them say, no, I want to have coverage the first month I turn 65 that I'm eligible. So we're meeting clients up to 3 months ahead of time as a result of that.
Okay, so, and if you miss, I think I said this before, if you miss your initial enrollment period, what do you do? Well, between January and January 1st through the end of March, you can enroll in Medicare Part B or A if you miss both for an effective date of July 1. And keep in mind, there will be a late enrollment period for that.
So I don't think this is a situation, if someone asks you, how does this work, that you would want to place a client in missing an initial enrollment period, because not only is the coverage delayed, there's the potential for late enrollment penalties. And these penalties last for the life of the client. They don't go away. There's one exception if they do qualify later at some point for Medicaid, but generally speaking, that doesn't happen. The penalty on the Part D late enrollment is around 10% or so, and then there's some formulas we can help you with in terms of how that works.
Okay, Medicare Supplement. Now you have your A and B. You do have 7 months or 6 months after you turn 65 and which to enroll in a Medigap plan.
The reason for that is there may be medical questions on a private insurance Medicare Supplement beyond the 6 months. Okay, so the guarantee period is extended on supplements to be six months post age 65. Notice it says in the middle bullet point, no medical underwriting if you enroll in this time. We have several people that take advantage of that.
Okay, so what happens if you're working past 65? Well, you may want to delay your Part B coverage, and you can do that. You do need to, when you're applying for Medicare, you do need to include that onto your application with Social Security. So, and if you've had group coverage and you want to drop it, you have exactly 63 days in which to enroll.
We try to tighten up that 8 months and say, if you want to have an Advantage plan, or if you want to take A and B alone and just have a drug plan, you go to the second line. you basically need to make a decision within 2 months. So we call that attention to clients that don't just think the 8 months. At the end of the 8 months, they say, well, I'd like to have drug plans. Wait a minute, we missed it. You had to do that, prior months earlier.
Okay, so here are the late enrollment penalties. Okay, so if you do qualify, Part A, some people say, well, Part A, as long as you've contributed, you're into your 40 quarters, your credits rather, you can get Part A free. But we do have people that come over here, the legal residents, and they do not qualify for Part A, and so they have to pay for Part A. So they can opt to pay for it. Part B, again, penalties 10% for each 12-month period that you delayed enrollment, and the Medicare Part D is 1% of the average daily amount of the nation's average of premium. So it's dependent.
Let me give a little example here. Let's say someone enrolled in Part A at 65, but they've been working. They never enrolled in Part B because they have creditable coverage from their employer. Now they decide at 68 to drop coverage for whatever reason. They're leaving their employer group insurance. Now they want to apply for Part B. So there is actually a form that the employer fills out that says, guess what, Medicare, we have a member here who has credible coverage for the last 3 years. That form is completed and signed by the employer. Then the second part is the member, the person, the client, takes that form, attaches, I want to apply for Part B, sends Social Security, and then they get their Part B. We always counsel that, let's say your last day of coverage is June 30th. Let's talk about this 2 months, April, May, let's get all this paperwork done, and let's make your Part B effective July 1st. And if you so choose, a Part D or a Part C plan. It's always best to be in front of this instead of behind it when you do that.
Okay, so when can we change the code? If you've opted for an Advantage plan or a prescription drug plan, the time to change is October 15th through December 7th. It is now. On the supplement plans, you don't need to change those now. That can be changed at any time during the year because it is not a contract with CMS or the government. So if you have it, now is the time to look at it. And then if you decided that you had if someone goes into an Advantage plan and they say, hey, you know what? I really don't like the Advantage plan. I don't like using the networks. I really want to drop it and go back to original Medicare and maybe go to a supplement plan. You have that opportunity between January 1st and March 31st to change it.
It's kind of seamless because if someone wanted to drop a prior Advantage plan, all they would do is enroll in the Part D prescription drug plan, and that would supersede the Advantage plan. And then they would be brought back to A and B, and presumably they may be looking at a supplement during these 3 months, whether they are applying medically, non-medically, that doesn't matter. So that's sometimes we see that option. People said, I'd like to go back to how do I do it? Takes a little bit of the client understanding.
Okay, and there are some times during the year that are considered special enrollment periods, specifically if you're retiring, leaving your group coverage, or moving geographic areas.
Just some things. If someone enrolls in an Advantage plan, they should have a pretty good working knowledge how that works. For instance, if you're in a plan, and we're going to go into these types, an HMO, I'm going to say that now. An HMO requires that you stay within a network, you get referrals. If you go out of the network, then someone says, how come I wasn't covered? Well, it could be because they didn't understand how it works. So it's always good to understand how the plan's provider network works.
Okay, this is just some information on where to get additional assistance. Again, I think, I kind of went to the end.
Okay. So go back to the slide of the combinations, because that may be something that we have some questions on.
Oops, okay.
Right here. This is kind of your guide map. When someone sits down to you at 65 and they're talking about Medicare, they're going to fit into one of these configurations. And the reasons why are not just because it's a better plan, it pays less. It could be because it's health situations. So if anyone has any questions at this time, maybe we could take that and address that.
Kathy and Dave, this is Amy. I know a lot of our clients who come in and we're doing long-term care planning, or they're already into crisis Medicaid planning. They get very frustrated if they have an Advantage plan because it's not covering any rehab or very minimal rehab for them. And then once they're in the nursing homes want them to switch back to traditional Medicare, but they can't. They're not going to be able to switch over, of course, to a supplemental plan. So then they just have traditional and Medicaid. Can you talk a little bit about the Advantage plans and how it's not advantageous for people if they need to go on rehab?
Yeah, well, that's a very dependent question. It depends on what they're in rehab for. And if they have the HMO, that's where I see people struggling with that. I will say that if they do have an Advantage plan and they're moving into a skilled facility type, if it's a permanent situation, that does give them a special election period where they can drop the plan and go back to original Medicare and just pick up a prescription drug plan.
So I think, Amy, what you're talking about is probably that situation. Someone had independent living, they go into a facility, that prompts a change of address for Medicare, that prompts an open enrollment situation with no medical questions on a Medigap, and you can also take a Part D plan to complete. So you would be talking about probably on this page, the last part of that, and then that would give you the ultimate flexibility while they're in that confinement to have a doctor come in, be covered, to have everything Medicare gives and have the Medigap pick it up. In fact, we've done this in certain cases with guardians where we've done the Medigap plan because someone moved and they had a variety of conditions, but they qualified for that. Then when you look at the pricing, the Part B is everyone pays. You look at the pricing of Part D and the pricing in the Medigap and you say, gee, generally that's my maximum out of pocket. There is the $203 deductible if you take G. We compare that maximum price. Let's say it's a $3,400 out of pocket. If you compare that to a Part D, which is a PPO, a lot of them are around $4,900, okay? And doctor visits are contingent upon going outside of the facility. There is out-of-network coverage available on a PPO, but the $4,900 balloons up to $10,000. So now we're not only talking about the delivery of the benefits, but we're also talking about an economic situation here. We're actually able to save money by going to a more complete coverage using Medicare AB, Part D, and a Medigap plan. But once again, that's a situation that would prompt another special enrollment period. In fact, we just met a client the other day on a special needs plan. The woman was hospitalized in Tampa, lived there. She came into rehabilitation. Now she's living down here with her son. He says, I need to take care of her in my home. Change of address. We actually used a special needs plan, change of address, SEP reason, special enrollment period. That's the reason, change of address. And we enrolled that particular person in our dual plan, which really allows in and out of network coverage. Most, if not all, of the copays are zero because she is on full Medicaid. And she also has, I don't think we ever mentioned it in this discussion, but what they call extra help. Extra help is a Social Security benefit that pays for your Part D drugs. Now, you may not qualify for Medicaid, but you may qualify for extra help. There's different income requirements there. So sometimes we see someone may be better off with the Part C, D, which is the second right-hand column, and their drugs are being paid fully, and they're satisfied with that. Change of address, something happens, they go down to the other one. So it's not, you're always in one particular situation. It does call for the circumstances involving that. So I hope that answers that question for you.
Did that answer the question, Amy?
Sorry, yes, yeah. Blake, did you have something?
Amy, I've seen that happen before. I had I had one client come from California, from LA, and she was on a real crap plan. She's from here. Well, no, she's actually from LA, moved back to LA, like in later years, and then came back to this area, and she had just a $0 a month California, one of their, you know, I don't know, socialized medicine plans or something out there. And yeah, she got it fixed real quickly with a special enrollment. I found out about that myself when I thought I was on auto pay for my health insurance, and I wasn't, but I just moved. I was in the same zip code. I moved one block, and I got it all fixed.
Yeah, I've actually used it for for one of my wards under guardianship, from moving from a home into a facility, a memory care unit. And it worked. It was, you know, okay. And it was really just a matter of a zip code change, honestly, but it was, the plan still covered her, but I was able to switch the plans around. So it works well that way.
If you have a client where the income is suspiciously low, then Social Security is your first start if they're going to take an Advantage plan, 0 premium, because you can call up Social Security and say, I want to initiate an application for extra help. You know, it's sometimes called low income subsidy, LIS. And Social Security would take their income, brief questionnaire, and they would qualify them for any one of, I think it's 3 levels. But the 100% level, it could be someone's got a $6,000, you know, rheumatoid drug. And you have to have a Part D plan. It's because Medicare, remember, doesn't pay drugs. So they enroll in a Part D plan. It's $40 a month, $30 a month. They get extra help. Extra help says, gee, maybe we can help you pay part of that premium. Or if it's in a C, there is no premium. It's just included. And gee, that drug would have normally cost you, you know, a deductible $400 and $100 every month. Lo and behold, they get the extra help, and it reduces down to $3, $4, that kind of thing. Now, they may not qualify for Medicaid, but you would be doing your clients a whale of good and saying, you know, you got to take a look at this extra help situation, depending on what, if you're in a, we see that a lot on the Advantage plans. 0 premium, $10 to go to doctor, no dollars to go to doctor. I got all these medications, I'm getting killed by it. Apply for extra help. And we have our clients that way stay with us for life because we helped them out. But
And I will say, on the rehab facilities, you need to make sure, and I think this is where some of the issue comes, you know, if they're going in, if the rehab is covered under Medicare for the first 20 days after they come out of a hospital stay. So they have to have 3 overnight stays, not under observation. You actually have to be admitted into the hospital and come out with a qualifying skilled condition for the rehab to be covered. So I don't know if that's some of the issue as well. And if under the Advantage plans, they do have to be a network rehab facility. And some of these rehab facilities, they don't like networks and they like standalone care. So that's a little bit different.
so that's a good example, Kathy, because if you had Medicare A and B, the Part D, not even the Part, but the Medigap, and you had what's called an F or a G plan, after 20 days, you would still have the Medigap plan paying for the costs of that skilled nursing facility, which I think the next 30 days, 40 days is like $160 a day. You would not have that on an Advantage plan. You would pay that price and it would start to fill in that maximum out of pocket bucket. You know, I mentioned about $4,900. So the Medigap, there are some instances where there are payments made that the C plan doesn't pay, but the C plan starts summating all of the money you put into it. Okay, so we have clients that are paying that last configuration on Medigap, maybe $2,700 a year maximum out of pocket. They can't find an Advantage plan that has $2,700 maximum out of pocket. The difference is they're paying the $2,700 on an installment plan. The Advantage plan is they may or may not ever hit the $2,700, and that's the eternal question. Okay, so but normally we have a lot of clients that are really making a lot of use, seeing healthcare providers, and they just glide along very nicely on the Medicap side. We have some people, I only go to the doctor once a year.
So-
Advantage plan.
And I will say on the Advantage plans, they have to follow, the coverage has to follow what Medicare covers. So if it's under Medicare A and B, it has to be followed under the Advantage plans. So,
I had an instance where I had a client call me up. He says, my doctor prescribed this back brace. And I guess the doctor was a part inventor of this. And he says, well, your Advantage plan you have me in, they declined it. And I said, well, we can actually help on an appeal basis. Instead of calling a 1-800 number, we have a process here that helps clients. And the maximum is something like a 72-day turnaround. We'll find an answer or a solution. So that's another reason. But anyway, we found out later and beyond, I kept asking this gentleman, they kept getting it declined. I said, send me the letter that you got. It was a letter from Medicare saying that this is an experimental device on the durable medical equipment. We're not going to cover it. It has to go through our period of testing, whatever it is. So that's an example. If Medicare doesn't cover it, neither will any of these plans. Okay, so that's something to keep in mind. Any other questions maybe we can help with?
I don't see any more questions that have come through. I want to thank you both, Blake and I, and Lauren, I'll thank you both for
Thank you.
the informative. I know, you know, by putting it up on YouTube, there's going to be more attorneys who can be able to, you know, educate their clients better on this and the differences. So it's very helpful. Thank you so much. I appreciate it. So,
Oh,
and
thank
your contact information was on the first slide. So if anybody needs any of that, because they are a resource. And we thank everybody for who attended. We really appreciate it. Next month, we do have Chardine Hill, who was, we were blessed for many years. She was our attorney for the 20th Judicial Circuit for a grievance committee. She was head of that. And she is now on her own for the last couple of years, and she is going to be talking to all of us on how to make sure that you keep your practice ethical and stay out of going to see the grievance committee and all of that. So so make sure that you sign up for that, as well as if you need your ethics credits. Lauren is going to help us try to get some of those too. So we thank you. And if you have any suggestions as we're starting to put together 2022, let us know.
Thank you, everyone. Have a great day.
Thank you.
Thank you.